I'm Pat Doris. Welcome to The Story, and welcome to Friday. It's the first Friday of summer. You know, Portland has had drug problems, but they're out of control on our streets now like we've rarely seen before. And so Portland's mayor has decided it's time to do something about it, or at least to try. And that is our big story tonight. Next week, Mayor Ted Wheeler will ask his fellow council members to vote yes on a change to an existing law. He wants to expand the city law that makes it illegal to drink liquor in public to include using drugs in public. The current law is found in the Portland City Code, Chapter 14A.50, Conduct Prohibited on Public Property. Skip down to 14A.50.50.10. And we'll find that this law was last changed in June 17th of 2011. It reads that it's unlawful for any person to drink alcoholic liquor upon any street, sidewalk, or other public right-of-way. Now, if the mayor idea passes, the lawyers will insert a few lines in there. The new ordinance would read, it is unlawful for any person to drink alcoholic liquor or to consume a controlled substance as defined by ORS 475.005 upon any public property or any street, sidewalk, or other public right-of-way. By the way, in case you're wondering, Section C of that city law makes it clear that sidewalk cafes and places with licenses, they're exempt from that alcohol prohibition. But let's stick to the topic, which is drugs. Portland Mayor Ted Wheeler apparently not interested in holding a press conference where he'd have to defend his plan, instead issued a video statement on the idea. Here's part of it.
Portland's growing substance abuse problems have exploded to deadly and disastrous proportions. This year alone, Portland Police Bureau has already initiated over 100 suspected overdose death investigations. According to data from the National Survey on Drug Use and Health, the state of Oregon ranks #1 in the nation for adults and teens reporting an illicit drug use disorder in the past year.
Now, I don't know about you, but I'm instantly suspicious when a mayor or any politician chooses to skip the press and just release a statement like that. In my opinion, we should and do expect more from our leaders than a canned statement on video. At the same time, the information is worth considering. More than 100 overdose deaths in the city of Portland in the first 6 months of this year. That's an average of 4 people dead from drugs every week. So, is there a problem? Yeah. Measure 110 decriminalized small amounts of hard drugs, but it seems the impact has gone much farther than that as open-air drug markets spring up around Portland. The mayor says it's time for change. While it may be legal to have small amounts of drugs, he wants to make it illegal to use those drugs in public.
This is a common sense approach. We must make it clear that people cannot use drugs in public spaces. I appreciate that this ordinance has support from the Portland Police Bureau and the Multnomah County District Attorney's Office, but it's going to take all of us working together to make the kind of systemic change our city desperately needs.
If approved, violators of the new city law could be fined as much as $500 or get 6 months in jail, or maybe both. Prosecutors in the courts would have the final say, but of course, the city also said that alternatives to criminal punishment will be used. Which brings up the question of, will there be actual consequences? I mean, I guess we'll see. But that's a discussion for another day if this proposal passes. Anyway, what do the frontline workers think about this? And by frontline, I mean the cops who deal with open use of drugs all the time. Well, I had a chance to talk with their union leader, Aaron Schmautz, today. He is also a veteran Portland police officer. He says the ability to arrest someone is a good last resort.
So, I mean, I've said a couple times, we're never going to arrest, and we shouldn't arrest our way out of an addiction problem that is at the core of itself a health issue. But people who engage in narcotics use on the street create some livability issues. They also very often engage in low-level criminal conduct to support that habit. And so, when police officers are out in the street, I've been working with some different treatment teams to figure out how we can get some, quick resources to police officers. We need to be focused on getting people into treatment. If we have people on the street, however, who are resistant to that treatment, who are daily engaged in conduct that is creating police calls, that is creating safety issues, that's where that enforcement comes in. So I do think having a model that doesn't just focus on, people call the police, we show up, we arrest people over and over and over again. I think that is just as frustrating to people when they feel like there's this kind of like cycle. Police officers should not be thinking and are not being directed to go and just start arresting people based on this program.
Well, and I've talked to folks in the criminal justice system who say that the ability to arrest somebody and put them in jail, at least for a little bit in the past, has been effective in getting people into the drug treatment programs because they're not making good decisions when they're on the street and under the influence of the drugs.
Yeah, 100%. I mean, there was a town hall that I did earlier in the year where a mother who had lost her son to addiction on the streets of Portland, she was just weeping afterwards and saying, she said to me directly, the only time I knew that my son was alive was when he was in jail. And that's tragic. And to me, that is a bigger indication of the holes that exist in our service community, and of just the real depth of despair that exists for a lot of these families and for these people who are experiencing addiction. I truly believe there are times when people are so acutely ill and so stuck in this cycle of abuse that they just need a break. They need a stopping point. Now, we don't have detox right now. We don't have really a place to take people, and we need to make sure we have those places. And also, when people are so either psychotic as a result of their drug use or just unable to stop, I think a program like this where police do have that ultimate kind of backstop of, look, if you won't stop, we're going to have to stop you. We're going to have to do something to break this cycle. I think that is an important component in a system.
Finally, our night crew took to the streets last night to ask people what they think about the idea. Is it a good idea to make public drug use illegal? Would it cut down on crime?
And I just feel that we can't just make a measure and think that's going to fix everything. We've got to have support. We've got to have other things in plan. So now what? And that's more what makes me, like I said, it brings more pause and more questions to, okay, a measure is passed, now what?
Yeah, I would say so, especially shoplifting. Shoplifting is a huge thing in Portland, I know, and especially by drug users of all kinds.
I think that having it illegal in public would honestly be really beneficial. I've never really been a huge fan of drug use in public in general.
So some interesting thoughts there. The mayor will introduce his plan to the council next Wednesday, and of course we'll be watching. And I know, I said finally before, but I'm not done. But now I want to ask you about this. Send me an email, will you? Share your thoughts. The address is thestory@kgw.com, or call and leave a voicemail, 503-226-5090. I look forward to hearing from you. And while the Portland mayor's proposal is targeting all kinds of open-air drug use, fentanyl is obviously the big one. Lawmakers in Salem have now passed a bill to crack down on that drug. Right now, Oregon law does not have a Class A misdemeanor charge for possession of fentanyl. It does for other drugs like heroin, meth, and cocaine. Also, Oregon law requires proof of specific quantities of fentanyl, defined by weight and not by possession of pills, tablets, or user amounts, which is allowed for things like oxycodone. This new law changes all that, fixes it. House Bill 2645 received bipartisan support. It passed the House on a 52-1 vote and coasted through the Senate this week with a 25-0 vote. 5 Republican senators, by the way, are still walking out, and they did not vote. It now sits on Governor Tina Kotek's desk, awaiting her signature. If she signs it, the bill will take effect immediately. So here's what it will do. Anyone found with 1 gram or more or 5 individual doses of fentanyl can be charged with this Class A misdemeanor. The penalties that kind of charge carries are up to 364 days in jail, a fine of just over $6,000, or both. Advocates say the bill will take fentanyl dealers off the street. The Oregon Health Authority says in 2021, nearly 1,300 people across Oregon died from a fentanyl overdose. Coming up next on The Story, fentanyl is not only killing adults, it's taking the lives of teens and children as well. We'll take you to the state of Washington, where a baby was the victim of a suspected fentanyl overdose, why the child's grandmother blames Child Protective Services, and a new policy in Washington when it comes to removing kids from their families for safety reasons. That investigation is next when The Story returns. The fentanyl problem does not discriminate by age. We've had several stories about overdoses in schools. The drug kills teens and small children as well. In the state of Washington this year, a 1-year-old died from suspected exposure to fentanyl, a baby. The little girl's grandmother says she sounded the alarm to Child Protective Services months before the child's death, but she claims CPS did not do its job. And now some worry a new policy in Washington will lead to more tragedies just like this. Taylor Murfindeski with our sister station King 5 has the story.
This is baby Avril.
It was so cute.
Her Burlington grandmother, Danette Scott, has spent the last few weeks glued to these fleeting memories.
She says, no, I'm going to crawl and find a dog somewhere.
The memories are all she has left.
Yeah, I miss her.
1-year-old Avril died from suspected exposure to fentanyl. According to the Snohomish County Sheriff's Office, Avril was staying with her 37-year-old mother, where fentanyl was being smoked when the child became unresponsive.
The CT scan showed the worst possible brain damage. It was the worst day of my life.
Worst of all, Danette says she worked for months trying to prevent this tragedy.
Because in this case, there was a clear path to protect this child and keep this baby alive. I knew this was going to happen.
She says it all started last December while her daughter and Avril were staying at her Burlington home.
We had started to see drug activity. My spidey sense was going up.
The grandmother says she made a call to CPS after she caught her daughter using fentanyl around the young child.
I needed somebody to help me make sure that the baby was safe. And so that's why I called CPS. I was trying to protect Avril from fentanyl.
Medical toxicologists say even a small amount of fentanyl is especially lethal to kids. It's 50 times stronger than heroin and 100 times more potent than morphine. The Department of Children, Youth and Families, DCYF, responded to Danette's CPS report. She says they sent a social worker to visit the home, who tested Avril's mom for drugs and told Danette the results.
She told me she tested positive for fentanyl.
Danette hoped that news would lead to action, but she says CPS didn't do enough.
This would have been a wonderful place for her to stay until her mom got better. So what good did CPS do? Nothing.
The baby and her mom quickly left the family home, according to Danette. And a few months later, CPS closed the case.
I was just blown away.
CPS records show the agency knew fentanyl was still a problem for the family when they closed it. The caseworker reminded Avril's mother that fentanyl is extremely dangerous, encouraging her to think of Avril's safety if she chose to use.
How's that supposed to be safe? Shock turned to just fury and
Less than 2 months later, Avril was dead. A DCYF spokesperson declined to comment on the case, but says the agency will conduct a review of the girl's death. In cases like Avril's, where substance abuse is a concern, child welfare experts say the state's CPS workers can only do so much. A new state law called the Keeping Families Together Act significantly changes how child protection workers can respond. It raises the standard of what's required to remove a child from the home.
Recognizing that it's harmful to remove children from their home, that it has a disproportional adverse impact of Black children and families and Native American children and families.
Under the law, a parent's struggle with drug addiction is no longer a sufficient reason alone. Caseworkers have to prove to the courts that physical harm is imminent, and they must offer services to families. The law officially takes effect in July, but child welfare workers say the courts have already started operating under the new rules.
I'm incredibly worried.
Jeanette O'Belt is a CPS supervisor and the chair of a statewide policy committee for the union that represents thousands of DCYF employees.
We're already seeing children return to situations that we firmly believe are unsafe, and without enough protection in place to keep those children safe. I'm very worried that kids are going to be seriously harmed or even die.
She says the policy change has led some DCYF employees to resign from the agency because they don't feel confident they can keep kids safe.
The pendulum has swung so far.
Especially as the department continues to see a rise in cases of young kids accidentally ingesting fentanyl.
So that's something that our office will be looking at.
DCYF Ombuds Patrick Dowd says his office is keenly aware of the concerns.
I think that it will leave children at greater risk in some circumstances, but then I also recognize that there's the balance with What's the harm by removing children? At times unnecessarily.
He says his office is prepared to look for unintended consequences. It's one of the reasons why he's been tracking DCYF's critical incidents involving children and fentanyl. His data shows that since last year, fentanyl-related incidents nearly killed at least 38 kids who had prior contact with CPS, and another 18 children died.
We will have situations where CPS or law enforcement or the court, they don't have the legal threshold to take action. Does that mean they think everything is fine? No. We should have a different approach to engaging families when there are allegations of substance use with fentanyl.
I don't get to taste it yet.
Back in Burlington,
Heart-wrenching that I won't be able to see her again.
there's one memory of Avril Danette wishes she could forget.
Right before I told her goodbye.
This is the last time she saw her granddaughter, surrounded by medical staff, helping her breathe.
So I just went down and, kissed her. And then I just told her, it's time to go.
In Burlington, Taylor Muir-Fendereski, King 5 News.
How awful. If you or a loved one is struggling with alcohol or drug problems, call this helpline to find ways to get support. The number on your screen there, 1-800-923-4357. Again, the number one more time, 1-800-923-4357. Coming up next on the story, it's an act of kindness that's gone on year after year in Gresham for a decade. The man at the center of it all expecting nothing in return. Hundreds of plants not only growing peppers and tomatoes, but also a sense of community. That's next when the story returns.
Next at 6:30, a new approach to the fentanyl epidemic, how it led police to arrest a man they say was acting as a doctor, plus $400,000 and counting, the huge fine OHSU will have to pay after it concealed videos of animal testing. And minimum wage about to go up in Oregon, why the increase depends on where you live. Plus, Joe's got your forecast for the first weekend of summer. That's next at 6:30. We'll see you then.
For many, horticulture is quite the hobby, growing things in the garden, managing them along the way, and finally enjoying the fruits or vegetables of your labor. But a Gresham man uses his knowledge and skills in the garden to spread joy to neighbors and even strangers. Catherine Cook and photographer Kyle Connolly show us how in this edition of Pacific Storyland.
These are all tomato plants. Tried every kind there is just about.
In Joe Kellner's Gresham garden.
I make makeshift racks to put them on and stuff.
It's a busy time.
This is where the process all starts, in this little greenhouse.
Though there is no off-season here.
Start in February with the peppers because they're slow growers.
This year, Joe will grow around 300 peppers, tomatoes, and other veggie starts.
Then just take care of them and fertilize them and water them.
But what, you may wonder, does one man need with all of these plants? Plot twist.
I'll get rid of them. If you live in Gresham, come over and get some plants.
What Joe is really cultivating out here on the corner of 19th and Juniper Court.
At my age, the ground's too far down.
Are relationships. New ones and old.
Hey. Well, hello, Bill.
It started about 10 years ago when Joe retired. He doesn't advertise what he does.
Anyway, here's a sign I put out.
For the most part. And he certainly doesn't tweet about it.
I got a flip phone, so I'm a little behind in the technology of the modern day stuff, but enjoy being behind.
Yet somehow,
this is a tomato Italian Goliath.
Okay. They still find him. All the people who might otherwise have just driven by. People like Lacey Eastman.
Another repeat customer.
She met Joe last spring. Now,
I'm going to bring a cold one back for you.
All right.
They know each other.
Thank you. That's a rare thing these days. So I think it's very special that he chooses to spend his time doing this.
Delicious.
This hobby,
Regular than that. All right. Thank you, sir. Okay. Have a good day. You too. Take care.
has really grown on him.
It makes people happy to see the people come by and get the free plants, and they're happy. And they said they want to pay me, and I said, no, I don't need it. I do it for the fun. I don't want to be paid. Just like to see people happy.
It's hard to know how many plants Joe's given away.
Thousands.
Or how many days he's brightened.
Let's neighbors be neighbors again. Let's get along with our neighbors.
When you're actually Joe's neighbor,
we did it this way so we could talk.
It's really something. Alex here has lived next door for 50 years. What Joe does with all of this doesn't surprise him one bit.
Because he's a good man. Good neighbor. He's always been good to me. In my good times and bad times.
I like taking care of people.
And it doesn't stop when the plants die back.
I do a lot of canning too. Pickled asparagus.
Don't act like you're surprised.
One year we made over 400 pounds of sauerkraut. And again, it's just all to give away.
Pickles and jellies, salsas and soups.
I got a freezer in my garage that's just for soups.
Joe makes sure those get to neighbors who are getting on in years.
One down the street just fell and broke her hip here about 3 weeks ago, so I took about 6 soups down to her.
He helps the young ones, too.
Do you like cherry tomatoes?
Yeah, we love cherry.
This gets 10 foot tall.
And he helps the middle-aged ones he just met.
If you want a few plants before you go,
I might take you up on that.
Every plant.
Just what you ordered.
Yep, I appreciate it, man.
A delivery of hope for regrowing faith in humanity.
Be good to them. It's what my mother would have wanted, I guess. All right. Thank you, sir. I appreciate it.
In Gresham, Catherine Cook, KGW News.
Way to go, Joe. I'm glad we get to celebrate you in Catherine's story, and looks like Catherine got a couple plants as well. By the way, Catherine would love to hear your ideas for her series, Pacific Storyland. You can text her at 503-226-5088 or email pacificstoryland@kgw.com. Well, that's the end of our show. Thanks so much for watching. And remember, the story, our collective story, that just never ends. Stick around now for the 6:30 show. We'll enjoy your weekend, and I'll see you right back here on Monday.